Welcome everybody to our quarterly Utah Suicide Prevention State Plan webinar. We have an amazing presentation today about suicide postvention in our toolkit. But a couple housekeeping items as we get started. Since this is a webinar, we will not allow you to turn on your camera. What we have instead is a Q&A box that you can find at the bottom. And if you have any questions or any comments that you'd like to make, go ahead and type it in the Q&A box. We will do our best to respond to them either with a written response or at the very end when we're doing our live Q&A. So go ahead and get all your questions in throughout the presentation and we will answer them. This is also going to be recorded. So this will be posted on our website as a YouTube link after this presentation, and we will send that all out in an email. So if you missed part of it, then that will be there in addition to all of the questions that we hope to answer. And with that being said, I will go ahead and turn the time over to Allison Faust.
Great, thank you. Brooke, do you want to go ahead and put up that first poll while I introduce myself and my presenters today? We just kind of want to get a sense. We've got about 105 people on right now, which is a great turnout. I would love for you to fill out this poll so that we get an idea of who's here. So just take a second to do that. My name is Allison Faust. For those of you who have not attended one of our webinars before, I'm our suicide prevention coordinator here in the state of Utah. We're really fortunate to have a lot of legislation in place in our state that supports suicide prevention, which is why we wanted to start this webinar series to help educate our coworkers and our community partners about what exactly is happening at the state level in terms of suicide prevention. So, you know, my position is in statute as well as our state plan for suicide prevention and our statewide coalition. And so we wanted to find a sort of way to be able to communicate that work out to all of you. So I appreciate you all being here. It looks like we have a lot of people here today from DHS. So I'm excited to be able to share with our own colleagues what exactly we're up to. So today's a little bit, Ray, do you want to go ahead and share your screen? Today, we're going to be covering a topic that a lot of people are not super familiar with, and that's postvention. And so I have Carol Riddell and Ray Bailey here with me today to talk about this. Do you guys want to introduce yourself really quickly, and then I'll do my intro?
Sure. My name is Ray Bailey. My pronouns are they, them. I also work at DHHS with Allison, and I oversee our youth suicide prevention programs. And I also co-chair one of the coalition work groups, the LGBTQ+ work group.
And I'm Carol Riddell. I'm also at Department of Health and Human Services in our suicide prevention program. I use she, her pronouns. I am honored to be a part of the coalition and work on this team. I do co-chair the executive committee of the State Coalition for Suicide Prevention. Thank you.
Great, thank you guys for being here. So postvention is a topic that not a lot of people have heard about. And so we wanted to talk about what is available for resources at both the state level and the local level. So Carol will be sharing with us today, you know, sort of what her role is in postvention and supporting local efforts when there is a suicide death. And then Ray will be sharing kind of what training initiatives are coming up and how they will be scheduling those with our local areas. But we wanted to talk about postvention more broadly and what each of your roles are in postvention, because as Brooke mentioned, we did release a toolkit for postvention that will be a really great resource for communities, but it certainly is more targeted, right? And it's a resource for specific sectors to put together a postvention plan. So we wanted to talk about really just basically what is postvention and what is your role in postvention as a DHS employee or a community partner. And so Ray, if you'll go to my first slide, for those of you that have attended our webinars in the past, you've learned about our state plan for suicide prevention. We update this every 5 years. We just put out our newest version in the fall of 2021. These are our core strategies. And as you can see, one of our core strategies is around increasing support for survivors of suicide loss. So people who have lost someone to suicide. And one of the ways that we can do that is through postvention. And so next slide, please. What kind of legislation exists for postvention in our state, right? I talked a little bit about prevention. Now, postvention is after a suicide death occurs. You'll learn more about that when Ray and Carol begin their presentation. But what kind of legislation actually exists for after a suicide death occurs? We do have the statewide coalition and state plan that are prioritizing postvention, but we also are really fortunate in the state of Utah to have a suicide prevention research coordinator at the Office of the Medical Examiner. And so his full-time job is to look at suicide deaths and help us understand how we can better support individuals and communities. And then we also have a program for suicide cleanup and grief support services for families who lose someone to suicide and need those types of assistance. So know that all of those exist, and we will be sure to send out links to these programs with the slides and the recording. And then go ahead and go to the next slide, Ray. So I'm going to go ahead and just give you an overview, and then I'll pass the time off to Ray. What we're going to talk about today is what exactly postvention is, postvention and how it, the guiding principles for a postvention response, what are the existing resources, and then what are our upcoming initiatives here in the state of Utah. I'm going to go ahead, I believe, and turn it over to Ray first.
Thank you so much. So if we could put up the other poll, the postvention poll. So we're just wanting to gauge, are you familiar with the term postvention? So yes, no, or maybe you've heard it, but you don't know what it means. All right, so it looks like about a little more than half of you are not familiar with the term, which is great. That's why we're doing this. But awesome to see how many people have heard the term, and hopefully we can just give a little bit more understanding to the topic. So what is postvention? So it's an organized response after suicide or suicide death to accomplish one or more of the following. So we're trying to facilitate the healing of individuals from the grief and distress of suicide loss, mitigating other negative effects of exposure to suicide, and preventing suicide among people who are at high risk after exposure to suicide. So I know we may have talked in the past of ways that suicide can impact other people and may put some people at a higher risk for suicide that time after a suicide death has happened. So that's the period we're talking about here. So just a little visual, the presentation is called Good Postvention is Prevention, because those things are not different, or they're not unconnected. So this is sort of our continuum of suicide prevention. So first we have prevention, which most of us are familiar with upstream, promoting protective factors, increasing that help-seeking behavior. Then there's intervention, that's the crisis response. So support for people who are more immediately considering suicide and appropriate care, medical care, behavioral health care after a suicide attempt. And then postvention is that after suicide support for people and communities. So, and these things are not necessarily happening in an order. These are all happening at the same time in different places and where it's needed. So just to know, I know that there are like 3 boxes, but this is an ever cycling, and all of these things are happening very often. All right, so a little bit about the principles behind postvention. So these are from the Suicide Prevention Resource Center, which is a great resource that we use a lot to help guide our work, and it's some of the framework for our state plan. So these principles are planning ahead to address individual and community needs, providing immediate and long-term support. So right after the death, but then, down the road, tailoring responses and services to the unique needs of suicide loss survivors. So making sure that our response is not one size fits all. Obviously, there are going to be different needs in different situations, and involving survivors of suicide loss in planning and implementing postvention efforts. Just raising up those voices of people who have lived experience with this time that's very difficult. All right. So when we're thinking about postvention and how to do it, oftentimes it is reactive. So a suicide death happens and then we respond. Whoever may respond, if it's the state or on a local level, but we really want to be more proactive about it. So just talking about why thinking through postvention responses before a death happens is important. So as I said before, and as you might know, a suicide death impacts an entire community. I know I've heard the data point that a suicide death impacts like 130 people around them. And so, and that can be more people. So it's really looking not just at the people who are closest, but the wider community as well. So we want to support community members who may experience shock, disbelief, anger, confusion, or a sense of sadness. And really, as I said, making sure that we're targeting that not just to the people that you would assume need it, obviously like giving to the family and close friends, but that a suicide has a wider impact than that on a community. We want to be able to provide services to those people who might be at risk for suicide. So this is both general prevention, great to have a plan for how we're going to do that, but to be prepared to support the people who are most vulnerable after a suicide death and provide the right services to them. Things like grief counseling, that sort of thing. Providing a framework for communities so that they can make a response, provide those services to the unique needs of suicide loss survivors. So when we create a plan, we can really be thoughtful about what a community needs, what needs to be part of a postvention plan, and what would it look like for this community. And then we want to make sure that we're addressing immediate and long-term needs. So if we're purely being reactive, we're probably just thinking what's happening today, right now, or tomorrow. And postvention is a long process that is not just going to end a couple of days after a death. So we really want to be planning to make sure that we are capturing all of those needs and being able to implement them in a comprehensive way. All right, so I feel like we talk a lot about safe messaging, but it is so important. And we talk a lot about safe messaging for prevention, but we also want to talk about it in terms of postvention. So it's just a definition of postvention, of safe messaging. So that's communicating about suicide in a manner that is proven to reduce risk for vulnerable individuals already at risk of suicide, and increase knowledge, attitudes, and behaviors that are protective from suicide in all community members. So just being mindful of the language, the imagery, just the messaging of what we're saying, and how that can impact suicide risk and, could really help mitigate some risk or create more risk. So why this safe messaging matters. More than 100 studies have shown certain type of news coverage increase the likelihood of suicide. So after certain suicide deaths, the way that the news may report on it can increase the likelihood of suicide if it's done poorly. And the magnitude of the increase of suicide risk is related to the amount, duration, and prominence of coverage. So, big situations like when Robin Williams died, that was very prominent. There was a lot of coverage. It happened. It was very prominent. So it was all of these things that did lead to more suicide deaths. So thinking about maybe mitigating some of the risk in here. So, just making sure that we are not putting out messages for a long time and very prominently, and the impact that that might have. All right, so again, this is just basic safe messaging for suicide prevention. So we want to avoid saying successful suicide, completed suicide, that someone chose to kill oneself, or that they committed suicide, right? Because this has some, committed suicide has sort of like sin or crime connotations. We don't want to think of suicide as something that is a success if you die, or something that you've checked off your to-do list if you completed it. So we prefer to use language like, someone took their own life. They died as a result of self-inflicted injury, or they died by suicide. So just sort of thinking about our language, it's still hard. I've been working in suicide prevention for a couple of years, and I know that I still slip up sometimes because these are so often used in our culture. But being mindful and thinking about how we're talking about people who may die by suicide. All right, so specifically for postvention, we want to focus on young people and sometimes, and those people who are close to the deceased, people who feel like they might be to blame, so like family members maybe, or other people with relationships to the person, and those with pre-existing suicide risk. These people might be at heightened risk of suicide after loss, depending on certain factors in the death. So when we're messaging, though, we want to respond to all sudden deaths the same way, which I know I've been saying we need to tailor things, but this is just saying that like the magnitude, the duration, the amount that the way that we talk about a suicide death, we want those all to be equal. We don't want to be, glamorizing one person or really talking a lot about one prominent person, and then like totally not even, addressing another death. Like we want to be consistent in the way that we report on this or talk about it. And we want to reach out with compassion and concern to the family of the deceased. So, just making sure that you're there for your community members, and not even just the family, but the wider community that might need support. All right, so sort of related to safe messaging is this idea about memorials and funerals. So oftentimes after a suicide death, there will be a memorial, and that is a wonderful thing to do. But we do have some do's and do nots, things that you might think are harmless and actually have been shown to be sort of harmful in terms of reducing risk later on for suicide for other people. So as again, with the messaging, we want to be consistent in the ways that you memorialize suicide and other losses. So, not really talking about one person a lot, or and ignoring other kinds of deaths. We want to allow monitored, time-limited memorials if that's something that's wanted. So we want to have memorials that exist, or a place for people to, share grief or whatever they feel they need to, but that these should have an end point. And then do use messaging and memorials to rally around the cause of suicide prevention, and encourage the use of resources and positive coping. So we really want to focus on this death and understanding that there's a great need in this community for more resources, more access to suicide prevention, support, and that sort of thing. And we want to make sure that we're not having policies or traditions that you wouldn't want to or would not be able to uphold for every death. So if you have like a memorial concert for one person, you probably can't do that for every single person. So we just want to make sure that we are thinking about the way that we are, sort of publicly mourning this loss. Don't allow memorials that are permanent or that they glamorize suicide or the person who died by suicide, as that can have more of an impact, especially on young people or people who identify with the person who died to maybe also be at higher risk for suicide. And do not participate in messaging or moral activities that have a hopeless, morbid, or angry tone. So as both DHHS employees and members of the public, people who do suicide prevention, or, I mean, we all can do suicide prevention, right? So just making sure that we're being thoughtful about the sort of messaging that we're seeing, and, you know, sort of recognizing when, hey, this is like not going to help people. This is a very hopeless message, and that it might have a harmful impact on the community. So just want to make sure that we're not, you know, furthering that sort of discussion. And then we have a lot of resources for postvention messaging, which can be found at liveonutah.org/postvention. But we also do have significant safe messaging resources. We have a training. There's so much there for you to learn. So this is just from the Postvention website, sort of what it looks like. There's 4 different categories of things. So postvention, or community postvention, public communications, if you need grief support, or if you want to know more about school postvention. So all of these different, and this is just like a small sampling of some of these resources. There's tons of things in there. We're constantly adding. So definitely a great resource for folks to have. So I think now I'm going to pass it over to Carol to talk about planning for postvention.
Great. Thank you so much, Ray. I appreciate all that great information. Could you go ahead and advance the slide? Thank you. So I really want to talk about postvention planning a little bit from 3 different perspectives. You know, what role does the state have as opposed to local communities and the leaders there? There are considerations, but there are also times when we have some special considerations. So I want to really just cover those 3 things. Go ahead, Ray. Thank you. One more. There we go. So within the Department of Human Services, we have a team that focuses on crisis response and suicide prevention, and we are really here to support local communities. There's a lot going on at a state level, but there's a great deal that happens at a local level. So sometimes that may look like we get a call, the local community, maybe the local health department or the local mental health authority will contact us and say, we've got a situation and we just need help. Sometimes that help can take a variety of different roles. Sometimes we look at it in terms of being able just to support logistically. Maybe they just need someone to manage time and space. Sometimes folks need assistance with more therapists, for example. So that's something that we can certainly do, providing assistance in that immediate response time. Then certainly following up and being available to, if it's analyze or look at and evaluate what that response was, how it happened, what could be improved, and certainly to provide training as well. We also offer, as Allison mentioned earlier, we do have suicide cleanup and grief support contracts out, and it really allows us to look at that whole piece around postvention so that folks aren't just left trying to manage that. We certainly coordinate with crisis workers as appropriate, and we provide technical assistance both before, during, and after. This toolkit, this community postvention toolkit, and Ray's going to explain it a lot better than I will. We really intend to offer that technical assistance and support to communities to better plan for postvention. We've talked about safe messaging. We can probably never talk about it enough. The more we can communicate a reduction in stigma, the more we can communicate in a positive manner that builds hope, all the better. And that includes things like if there's going to be a press release, we can assist with reviewing those statements or any other public response. And I just want to emphasize the media outreach. You know, the Department of Health and Human Services communications team is available to provide training about how to respond and how to do press releases and how to deal with the media. That's something that's been offered for quite some time. And I honestly don't know how often it gets requested, but it's certainly available, just like the safe and effective messaging training is already available. We want to be sure that we're empowering communities to respond after a suicide death. Next screen. Next slide. There we go. So when we think in terms of planning, we all make a difference in suicide prevention, and we all make a difference in a postvention situation as well. But planning sometimes is more focused on the folks or on the individuals that have that training and that background. So we think of our local mental health authorities, our local health departments, think of faith leaders, emergency response managers, funeral home directors. Those are the kind of folks that can come together and really engage from their expertise what could be a part of a need, what could come up that we have to deal with, and how do we prepare and plan in advance from that. Those individuals may not be the ones who respond to the actual crisis or to the suicide death. That's important to create a list then of individuals. Well, who are the best responders? Who can have their best role and respond in a unique situation? If someone dies who's Catholic, it might be helpful to have a responder be a Catholic, those types of things. So just being aware that who responds in a situation is unique to that individual and their family and the situation of their death. We do want to understand those key roles based on those circumstances. And certainly if someone prominent in a community, we certainly hear of the national ones, as Ray mentioned, with Robin Williams as an example. But certainly if someone is prominent in a community, their death may have impact in many circles. It could impact in their workplace. It could impact in their school or their children's schools. It could impact at a faith-based center. So recognizing that sometimes a response just to a family may not be enough. There are many people, 130 some people affected by every death. And if that person is prominent in a community, that may even have further reaching impact. So being able to look at each situation uniquely and plan for that, plan as best we can for each unique situation. And certainly one of the things I think is important to remember is that we don't really stop doing what we're already doing in suicide prevention. There's so much that we're already doing. We don't suddenly stop everything we're doing and respond to a death. We need to continue all those efforts around suicide prevention. That needs to continue within our communities. Next slide, please. And when we think about certain situations, we don't necessarily change our strategies, and we shouldn't. We should be continuing to look at suicide prevention and all the ways we do that upstream, right? Everything we are already doing. But there may be situations in a community that we need to kind of keep an eye out for. Socially related deaths, where maybe two co-workers, but one lives in Riverton and one lives in Ogden. We don't necessarily think of, well, they're connected, but maybe they are because of where they work. So how people are connected and resulting in those deaths is an important thing. And our local health departments will be looking at that along with our Office of the Medical Examiner. Certainly, something to be aware of is if there's an increase in a specific method of death, a specific means, that's something to be aware of as well. And again, it's not something the media is going to know. It's not something we're going to know necessarily, or each of us on this call will know. But that's something that we can really look to our local health departments for that information as they collaborate with our Office of the Medical Examiner. And I think I'm turning it back over to you, Ray. Talk about all the things that are coming.
Sorry, muted. So thank you, Carol, for offering some insight about some things that we that community members or more formally local mental health authorities or health departments, what a community should be thinking about in terms of planning a postvention response. So we just want to share some exciting upcoming initiatives. So the first one, which is incredibly exciting and is several years in the making, is the Community Postvention Toolkit. So really this toolkit is for local areas, communities, so like I said, local mental health authorities, health departments, sort of like crisis services, for them to come together and create a postvention plan that is rooted in their community. So, reiterating that everyone has a role in postvention, different roles, but, you know, everyone has a part to play, even if that's just, you know, continuing to promote safe messages of hope and recovery, or providing resources to others. So with this toolkit, it includes community leaders in healthcare, emergency response, mental health, faith, etc. So all of the people, like what Carol was saying, that if the person has a specific religious background that might be prominent in that community, or that they are part of, making sure that we have representation from those communities that will help inform the specific response in different situations. And again, everyone benefits from safe practices and access to resources. So, you know, there's never any harm in making sure that we are spreading further resources, or connecting people to support that they might need. And the toolkit also, you know, focuses on how we talk about a death. So again, the safe and effective messaging for suicide prevention training that exists. So within the toolkit has these tools, which are cool, toolkit. So things like assembling a postvention planning committee. So like Carol said, the planning committee will not be the same as the response committee. So for some of you in your roles, that might be something that you would be part of if you know, work with crisis services, or if you're working in one of those areas that might be looking to create this plan to begin with. And then writing a plan that's unique to a community. So making sure that we are creating a plan that follows the principles of good postvention, safe postvention, but then also recognizing the differences in every different community, and differences within a community that you might know about. It provides information about how to activate a plan. So after there's a death, you know, how do you know what to do right after, or, you know, a day after? Like, what does it look like once you start this response? How to dispatch a response team, deactivating the response after a certain period of time, obviously continuing to do prevention programs in the area, and then evaluating the response to improve future responses. So an exciting thing that we're going to be doing with this toolkit, which I think is amazing, may not be something that you will specifically be writing a postvention plan, but I think that there's a lot of information for anyone there. But for specifically local mental health authorities and local health departments, who we are encouraging to create this sort of plan, have it in place for their community, we're going to start doing, we're in the process of planning some in-person workshops for those areas. So for those communities, 13 or however many communities throughout the state, going to them and helping create a plan, and providing that technical assistance to say, hey, you know, I need help with this, or what would you do in this situation? And the toolkit also has like worksheets and stuff. So you know, sample media communication. So what would you email to certain people in different circumstances after death? So providing some, hopefully, very practical tools to make your postvention response safer, and hopefully taking one less stress off of a very stressful situation. Sorry about my eyes watering. I'm not crying, it's just allergies. So I'm very excited. That'll be hopefully starting at the end of August, early September, that we'll be making sure that we're reaching out to and connecting with those different local mental health authorities, different communities, to create these plans. So it's also very exciting because we created this toolkit because there wasn't a toolkit like this. You know, there's a lot of resources, not a lot, but there's more resources for how to deal with a death in a school situation. So if there's a suicide death at a school, how do you respond? Or on a college campus, something like that. But there's not really, you know, a good resource that tells you exactly step by step how to create a plan and how to carry out a postvention response. So hopefully this fills in some gaps. Hopefully it's useful both to people across Utah and other areas if it's applicable to them. But I think I'm always excited that when we in Utah can sort of do things first and help other areas and evaluate, how did this toolkit go? Was this helpful? And hopefully make it better. So, right. So I sort of went into this, but yeah, so part of this local community postvention planning will be ongoing support in developing and implementing their plans. So if, something comes up and they're like, we didn't have we didn't know how to deal with this, like helping fill in those gaps. And then again, like evaluating implementation and trying to make it better for the future. But obviously we're all doing, the best that we can with the information we have. But just making sure that we are doing the safest possible thing for our community members. And then we also, in the works is a crisis response toolkit for schools, which is similarly very sort of practical in terms of what it offers for schools if they have a crisis that they need to respond to. It's not released yet, so just sort of like a teaser, but it's a collaboration between State Board of Education and DHHS. And the audience is specifically for school administrators and school mental health professionals. And there's going to be a companion course on Canvas to help guide these administrators and mental health professionals through what this response might look like. And it's not specifically just about postvention, it's about crisis response in general, but there is an emphasis on postvention after suicide death, because it is such a delicate and difficult situation to navigate. So not out yet, but I'm sure we'll let you know once it comes out. So yeah, I think that is, I don't know if we can do discussion, Allison, or.
Yeah, I think I'll just kind of wrap up, and then what we'll do is if you guys want to utilize the Q&A box for any additional questions you have, we don't have the ability to unmute you, but we can answer your questions live instead of through chat, how we have been so far. So anything you enter, we can answer live on the spot. One thing I just wanted to say as kind of a wrap up, thank you so much, Ray and Carol, is that, we talked a lot about community postvention planning and the training and TA that's kind of coming for that. But I want to just circle back on everyone's role in this, which I really think is, now that you know about the toolkit in your professional and your personal lives, to share this and let them know that this is available and get something started in your community. Be an advocate for postvention. The other thing that I would say is, if you haven't had our safe messaging training, go take it. We have a 20-minute version on the liveonutah.org website under our state plan webinars page. Which I don't know if somebody wants to link that for me while I'm talking. I can't multitask. And I would encourage you to go take that, because what that does is teaches you your role in postvention, which is safe messaging, what to share, what not to share, when to maybe send me an email and say, hey, did you know that this is being publicized and this maybe isn't the safest? Do you want to reach out? We're totally collaborative in this process, and don't be worried to email us and ask questions. We have helped so many communities with, as Carol mentioned, press releases and fielding media inquiries that are maybe just difficult for your community to respond to. And then sort of on an individual level, letting people know that the resources we mentioned today are available, such as like grief support services, cleanup services, for families that can't afford those services, we do have them available under contract. So anything else, Carol and Ray, that you would say in terms of wrap up and like everyone's role in this sort of postvention planning before I start the Q&A?
Yeah, I think just reiterating the importance of safe messaging. I think it really can't be emphasized enough as something that we can all do. So, you know, that training is great to just have the safe messaging training knowledge about, you know, why certain things are good or, you know, less good to say. So yeah, so just providing those sorts of things, I think will be exciting to have more people, similar to how we have, you know, more gatekeepers in the community. We also want to flood the community with people who understand how to safely talk about suicide.
Thank you, Ray. So we do have a couple questions. So the first one is how long, I can start this one and then maybe let you and Ray and Carol answer. But how long is it expected to take to ensure that different communities in Utah have awareness of this toolkit and can get appropriate recommendations in place? I think some communities are going to be faster than others, right? A couple things I will mention is that we do have funding behind this at our state level that we're going to be providing to local communities. Very shortly, we are going to be hiring as a pilot test 5 local suicide prevention coordinators that are going to work very collaboratively with us at the state. And part of their role will be postvention and building postvention plans. And that will be happening very quickly over the next 3 years. They'll have to have plans in place over the course of the first year and then implementing those plans for years 2 and 3. Hopefully then we'll be able to prove good outcomes and continue funding. So as I said, we're pilot testing that in 5 areas. And then I know Ray and Carol are also going to be doing technical assistance and training and giving funding to local communities that don't get to hire a person to still be able to address prevention, intervention, and postvention, because we know that that's been a significant gap. So I don't know, Ray and Carol, if you want to add anything to that.
One thing I would add is that just as with all suicide prevention, how we plan and what we do takes time. And because we want to do it well, and we want to evaluate it along the way and find ways to improve it. So even if this is the first you've heard about postvention and maybe you don't feel like you fit that description of who would be on a planning committee, the reality is you do have a role. And hopefully the communities who implementing this will be reaching out and engaging a lot of folks from various sectors, various industries, various areas within the community. So I'm sure you'll be hearing more.
Thanks, Carol. Go ahead and chat in any additional questions. One other thing I'll just touch on without going too much into it, just kind of going off of what Carol just said is, you know, I think many of us are probably on this webinar because there has been such prominent coverage in our state about suicide deaths in the last year or so. There's been several high-profile deaths where tragically we lost young people to suicide, right? This postvention toolkit, as well as the safe messaging training that I've mentioned, again, go find it on Live On Utah, will help you understand what your role is in those situations, why it is research-based that certain things shouldn't be shared after a suicide death. It's not just being overly sensitive, it's that we know that certain things can actually increase risk for vulnerable people, and we might see additional suicides, which is really frightening. And so the information that we share is crucial that communities sort of begin implementing. And so just sort of re-emphasizing that piece, that this is all research-based, and we know that certain things increase hope and healing and resiliency of communities, but the opposite can also be true if certain best practices aren't followed. And this is a very new sort of field. So I will say, like, when we know better, we do better, right? People don't know this information. And so nobody's increasing harm on purpose. But now that we know that this information is available, we need to do our best to share it with our community leaders and get something moving. So let's see, where can we go for more statistics and research that Allison is mentioning? So the toolkit talks a lot about postvention research specifically, but if you're looking for research on suicide in Utah, we do have one of our previous webinars focused with our researcher at the Office of the Medical Examiner who does a deep dive into what it looks like in Utah, specifically on liveonutah.org on the state plan webinars page. I don't know if somebody wants to respond to this comment and link that, that would be great. And you can go learn more about it there for sure. Okay, you mentioned local teams. Will those teams be made up of only paid personnel, or will there need to be volunteers? If so, how would one get involved? I think what's really prevention work in general is very volunteer-based. I think we all know that there's limited funding for prevention. So the coordinators and the people on sort of the response teams and things like that will all be paid staff. But I think the best way to get involved, I'll copy the link here in a second because I linked it in a different comment. But each area, we actually work with a lot of prevention coordinators who oversee local prevention coalitions to address things like substance use, suicide, shared risk and protective factors for those types of potential outcomes in a community. And so they do a lot of like programs and training and things like that where you can get involved. And they might be able to tell you if there's a place for you when they begin planning for postvention as well. So we can definitely, if you reach out to one of us, get you connected with who your prevention coordinator would be for your area. So thank you for that question. Other questions about postvention in general? One thing, if you don't mind, Ray, I know you talked a little bit about language. There was a comment that I just thought I would highlight after you got done with those slides. Somebody was sort of asking, let me find it. You know, why are certain phrases more harmful than helpful? And you know, it can be really hard to talk about suicide when you're worried about saying the wrong thing, right? And so I wanted to kind of touch on this, and maybe Carol and Ray can jump in as well. But the analogy that I always give is that what we're trying to do with changing language is reduce stigma and help mental health be seen as equally as important as physical health. And how do we do that? By the way that we talk about it. That's the very first place we can start, right? So just how you wouldn't say that somebody committed cancer. You would say they died from cancer. You would say the same thing when it comes to mental health and suicide. They died by suicide. Those little changes feel really nitpicky, but actually what they do is reduce stigma so that people feel safer seeking help. And if people feel safer seeking help, more people are connected to resources, and hopefully suicide rates go down, right? So that's the analogy I always like to give, is that's ultimately what we're trying to do with changing language, is just making people feel safer talking about it when they're struggling. Carol, Ray, anything else you would add to sort of that language piece or the question that was asked about that?
I think that says it all. We have to reduce stigma. We've got to help people have hope, and the language we use makes a difference.
Okay. Other questions for our panelists? I believe our next one will be hosted in October. Oh, hold on, let me grab the safe messaging link for you. So under the state plan webinars page, I'm gonna link it in this comment. Oh, maybe not. Where did it go?
It's just an answered question, probably not.
Yeah, I went ahead and
oh, you guys are faster than I am. I was trying to, okay. So anyway, there should be a link to the state plan webinar page of our Live On site in the answered questions section, if you guys can see that. Are you sending out certificates for this training? We do not offer certificates, but you could like go ahead and claim however you can for your own hours, but we don't offer CEUs for these trainings. But thank you all for being here. It doesn't look like I'm seeing other questions, but we're happy to kind of hang out for a couple minutes. Otherwise, Brooke, any closing remarks before we let everyone go?
No, we just wanted to say thank you so much for attending this webinar. We will be sending out an email with all of the links that were described and a link to the recording of this afterwards. It will be on that same suicide prevention state plan website. So you'll be able to find all of our previous webinars. We've done 3. This is our 4th one, and all of our resources on there. But thank you so much for attending.
Thank you, everyone.